So what are we gonna draw today?
14-year-old Ethan Pyles enjoys drawing because this is something he does well.
It makes me feel like I can do anything I put my mind to, and that it makes me feel calm and relaxed. And I just like to draw. I like colors and being creative and artistic.
Ethan has crafted this skill due to many hours spent sitting as a child.
Ethan didn't start walking till close to like 2 years of age. And as he was growing, I didn't see him meeting those milestones.
I had a lot of difficulty riding a bike and playing basketball and like running around and playing with your dog. It was difficult.
So they had suggested, getting him tested for certain things. And we found out Ethan was on the autism spectrum.
Doctors ordered blood work in order to start the proper medication.
After we had the blood work done, like an hour later, his pediatrician called asking if Ethan was okay. And this was alarming to me, so I asked what the problem was. And Ethan had very high liver profiles. The normal range is, I want to say, around 300, and Ethan's were 18,000. Okay, well, we need to find out what's going on. So first we went to a gastroenterologist and then a rheumatologist, and they were ruling out all these different diagnoses, trying to get to the bottom of it, and we finally get to the neurology department. We saw the neurologist, and the minute he looked at Ethan, he said, "Your son has muscular dystrophy."
Sandra learned there are more than 30 different types of muscular dystrophy. Now they had to determine Ethan's type.
And it was like the worst day of our lives. We were told that Ethan had Duchenne's muscular dystrophy, and it's the most fatal. It's the worst kind to have.
So this is a genetic disorder of muscle caused by a mutation in dystrophin gene, which leads to decreased production of dystrophin protein in the muscle.
Your muscles are going to deteriorate. You aren't going to be able to walk. You're going to lose your mobility between the ages of 10 and 12, and it's going to affect your diaphragm, which helps you breathe.
Their life expectancy is in typically 20s, but most of the kids, they lose their ability to walk independently by 12th birthday. So they're wheelchair bound.
The only way they knew how to help these boys was to preserve any kind of muscle strength, was to put them on a steroid regimen. So Ethan has been taking a steroid, prednisone, since he's 6 years old. He's now 14.
Sandra found out Hershey Medical Center was participating in a clinical trial for boys with Duchenne Muscular Dystrophy. They would be given the drug Exon Dys 51.
The drug company Sarepta decided to do a phase 3 to get more adequate data for the FDA to help them make the decision on approving this drug, because there were no treatments out there for the boys with Duchenne's.
And this is a drug which ultimately leads to increased production of dystrophin protein in the muscles and ultimately having better function of the muscle.
In order to qualify for this study, you have to meet specific inclusion criteria.
He met all the criteria, which was the age group and the correct deletion.
It also included a 6-minute walking test, which Ethan passed.
I was so grateful because Ethan was at the end of his walking stage. You could tell.
2 years ago, Ethan started the clinical trial.
It's scary for us parents, and Ethan wanted to make a difference, and he said, "I'm going to do this. I'm going to participate in the trial."
I don't want it to just help me. I want it to help everybody that has Duchenne's too, and eventually have every muscular dystrophy have a treatment and eventually be cured.
When he first came, he was in a wheelchair all the time. He laid in the bed quietly with the blinds pulled and didn't really want to be stimulated much. And now he walks in from his car. He can run down the hall.
"We missed you."
Pyles, I missed you. When he comes for his visits, we access his Metaport and give him an IV infusion. We take vital signs throughout the infusion and monitor him for safety.
And the infusion would last for about 45 minutes, and then he would be monitored for about an hour afterwards.
After several infusions, Ethan could feel a difference.
Ooh, yeah, you rock.
It's really hard to pick a place to start. Like, I can do a lot of stuff that I can't do before if it wouldn't have been for the trial drug that I'm taking.
The list of possibilities is now endless for Ethan.
Lifting up heavy things and basketball, using my arms for stuff.
I'm so amazed seeing him, what he was not able to do before, now he's doing so well. It's very amazing to see that.
His drive to help himself and help other boys has brought him to become very courageous, and he's willing to do whatever it takes to make this drug available commercially.
Ethan and his mom, along with the other boys participating in this clinical trial, took their success stories to the United States Food and Drug Administration in Washington, D.C. There they testified before an FDA committee.
Phase 3 had approximately 180 boys involved in the study, and there were 1,000 families, April 26, down at the FDA to participate in the meeting.
I told them, I included in my story that stuff that I couldn't do before taking the medicine and stuff that I can do better after taking the medicine.
Unfortunately, their decision was against approving the medication, which was heart-wrenching, but 30 days later, the director, Janet Woodcock, it was her responsibility to give a final decision. September 22nd, we were informed that the drug got accelerated approval.
Felt like I wanted to jump like 6 feet in the air and do a backflip if I could.
Ethan, along with his friends, the original 12 boys and all the other ones in the study, they made history.
I was very proud of Ethan for what he did. It takes a lot for a little boy of that age to be able to do that.
Ethan not only made history by getting this drug approved, he hopes to make history with his future goals.
When I grow up, I'm hoping that I can go to a good college, and I want to go to a college in Florida that I can study marine biology, and I'm not going to let that not happen.
He's inviting all of us to his graduation, and he wants all of us to come see him when he moves to Florida. He's determined.
You know, I felt very sad thinking of what the future had to hold for me, what my fate was. But now that I'm taking this medicine, I don't worry about it as much. I feel positive in myself. I don't even think that I'm going to stop walking.
He's doing great. He's doing wonderful. We have our bad days, but you know what? 80% of our days are wonderful, you know? And I'm very happy. I couldn't be happier.
I know my mom. She's what brings brightness in this world. She's what keeps me positive. I don't know what I'd do without her. I don't think I'd be here right now if it weren't for her.